Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Millicent Rovelo, and I'm here with my most faithful co-host, Dr. J. Calvert. How are you?
I am very excited about our topic today.
Yes.
And first of all, I'm excited that we're back in what's going to be the studio at Podcast One.
At Podcast One. So if anyone's been listening over the past few months, you know that we've been doing a bit of a podcast studio shuffle because ours has been under renovation. So
It's the Podcast Studio Shuffle. The Podcast Studio Shuffle. Like that?
Yeah, like that.
Yeah.
That's it. That's pretty much it. But we're now back in our original studio, and it's undergoing a few renovations still.
For those of you looking on YouTube.
So don't be alarmed.
Don't
This
worry.
is not how it's going to stay, I've been assured. But yes, we are back here, which is why we have brought our own libations to commemorate.
Yeah, we've got to celebrate.
I celebrate with some sparkling rosé. I told Dr. Calvert at the store that it's very girly, and he was like, "I'm in."
I can do it. I can do it. I'm a plastic surgeon. You know, you gotta.
Yeah, you're
You
okay
gotta
with
be
the
able.
girly.
You gotta be in
Yeah.
touch with your feminine side. Like, it's not even champagne. It's like rosé wine
With bubbles.
something with bubbles.
That's
But
what
it's
it
pretty
is.
tasty,
It's
actually.
pretty
I'm
tasty.
gonna go there.
Thank you.
Our topic today is cool.
Our topic today is cool. It's even cooler because it came from a listener. So shout out to Chantal, who sent in a request for this podcast because she would like us to discuss what's very colloquially known as hip dips, or as she said, violin deformity. So take it away, doctor.
Violin deformity. I've not heard of
Violin,
that.
You know, so
Oh yeah.
yeah.
I got it.
Right?
As soon as you said it, I was like,
Yeah.
yes. Yeah, so hip dips, I think not everybody has them, and it's a thing that shows up typically in women that are wearing contoured clothing. That's where I think.
Let's just define where they are and what they are.
So the hip dips are a deficit of tissue that basically extends from what would be sort of I guess it's sort of the narrowest
It's the hip bone.
part of the hip,
Yeah.
but as it flares out to your trochanters, which are
Oh my
the
gosh, people. So it's the space between the hip bone and the top of your thigh.
listen, you asked, and
Trochanter? What?
trochanter is a term that people know. Do you not know what a trochanter is? No.
No, our producer Sean's looking at me shaking his head. No, he has no idea what a trochanter is.
SMH. So a trochanter is the widest part. It's a part of the femur, your big long leg bone that goes into your hip.
Connected to your hip bone. Trying to keep it real for the
I'm
people.
bringing a skeleton in here. That's all. Listen, you know, people need to know this terminology. Otherwise, they don't
Yes,
know
doctor.
this. So the hip dips are the deficit. It's on like the side of your butt cheeks. How's that?
Yes.
Side of your butt cheeks between like basically your waist and your widest
Upper
point of your
thighs,
hip.
yeah.
Yeah.
And so it's an area that, like you said, not everybody has these. But when you have them, like you kind of notice that there's this indentation below your hip bones on the side. And in women who are very fit and athletic, it can look like a very athletic toned, almost male kind of body. But a lot of times people want these areas filled in because
That's the bottom line.
if you're wearing very contoured clothing, like you mentioned, tight dresses, tight skirts, leggings, it's a very obvious sort of indentation in someone that's otherwise very slim, and it can make the upper thighs look bigger than they are because there's this indentation above them. And so the overall goal is to create a smooth contour that goes from a narrow waist into hips that are kind of rounded and flared out and then tapered down into the thigh. And when you have this indentation kind of right in the middle of that contour,
Violin deformity, like there's
it's
there's a deficit in the middle of the violin.
Yep.
There's a wide part up top, then it gets
Goes
narrow,
in
and then it
and it
goes
goes
back
down.
out wide.
and I think a violin is a very beautiful instrument, but some people just really don't want to have that kind of look.
They want to have a more contoured
They want to
violin.
have a more contoured
different.
violin.
I don't know why the violin needs to be shaped like that, by the way, because if you think about
Hmm.
it, the F holes that it has, and I know what
The
that sounds like to
F-hole?
you. They're called F holes. So that those are the areas that the sound goes into, it resonates on the inside and comes out, and that's what makes it a very beautiful, warm-sounding instrument. But for some reason, the top is wide, then it gets narrow, and then it gets wide again. So why does that affect the sound the way it does?
Maybe it's just to make it a really pretty instrument.
I don't know.
Might
There
just be to
has to
make
be
it
something
pretty.
to it because it's not like straight down like what we're talking about. I mean, maybe we need to fat graft every violin.
Every violin and cello. And
So I gave it away. That's what we do with these hip dips is we fat graft them.
yes. So, like any area that needs a little bit of filling and contour, our go to usually is fat grafting. And we do fat grafting obviously all over the body. And you can do fat grafting specifically just in this area. And, or you can do it in combination with a Brazilian butt lift or a gluteal fat transfer.
Sure.
In fact, if you are doing a gluteal fat transfer, this is an area that is very much focused on because, again, with the gluteal fat transfer, you really are trying to create that contour, the small waist, the rounded hips, the really smooth transition. So the hip dips in the face of a gluteal fat transfer are actually what we really try and focus on to make sure that we don't have those step-offs. But you can also just treat them in isolation as well.
Yeah, and fat grafting, we talk about fat grafting a lot. And the reality is that fat grafting works. It's a really reliable technique. Every time I tell somebody I want to do fat grafting, they go, "Oh, doesn't it all go away?" And I have to kind of say, no, it really doesn't.
It really
The
doesn't.
techniques have gotten very reliable. It all depends on how you treat the fat and how you there's the harvest. This is all about technique. Success in plastic surgery is about your technique, your technical approach to the problem and how you execute. And in fat grafting, it's how you harvest, what you do to the fat after you harvest it, and then how you inject it and place it into the deficit that you're working on. And I think if people, can think about it more as there's no one size fits all in fat grafting. Like what I do to fat graft a nose is different for what I do to fat graft, the cheeks and sort of the tear trough, which is very different than what I do for hip dips or a buttocks.
The butt or the breast. So it's very, very different. It is a technique, but it is not the same surgery in
Right.
every area. That being said, this particular area is a tricky area to treat with any procedure, but even with fat grafting, because that area, and particularly in somebody that has actual hip dips, this sort of concavity deformity, it's pretty much skin on like fascia and bone. There is literally no fat there. And so in order for fat to survive, for a fat graft to survive, it has to be surrounded by normal, healthy fat that's already in the area. It's that normal, healthy fat that lives in the area that gives the fat graft its blood supply for the first crucial couple of weeks until it takes and can survive on its own. But if there's not a lot of fat in the area to start out with, you can't just throw a ton of fat into that area and expect it to survive. It just won't. So when I have someone coming to me and we're talking about doing fat grafting for these areas, I do tell them there's a strong chance you're going to need a couple of rounds of fat grafting in this area, just so you know, because I can't throw a ton of fat into the area, even if you have a ton of fat to offer, because it won't survive. So we are probably looking at a staged thing. And I usually tell people that you'll probably get about 60, 70% of it to stay after one round. 2, hopefully that'll be enough, but maybe 3. It can be a really tricky area, especially depending on how deep those deficits are.
And for our listeners, doctor, what happens to the fat if you overgraft? What's going to happen to the excess fat?
So the fat that is not touching healthy fat in the area, it dies. That's called fat necrosis. And so anything that's in the center of the fat that's grafted and it's not getting a blood supply on its own, it dies. It typically just gets absorbed and flushed out in the lymphatic system, but it can form some little hard balls that you feel underneath the skin. They can feel
Yeah, like
firm
nodules.
or tender. Nodules, fat necrosis. They go away eventually, but they're kind of annoying. So no, you can't just go to town and put as much in there as you want because you may have some complications down the road if you do that.
Yeah, fat necrosis is so, and this is what you see in these massive BBLs that we see around town here, and it's like they're just I'm at a loss. That's all I'm going to say. But I get it. It's not what I do. Skinny BBLs. If you need 200 to 300 cc's in your each butt cheek, I'm your guy. Any more than that, I've got some referrals for you. But the reality is that if you don't have blood supply to that fat, it's not going to survive, and it's going to get necrotic. It's going to die, become scarred in, firm. It can get,
Get infected.
you can get
Yeah.
calcification. It can be not awesome.
Right. So you just kind of have to know that it's a process and you may need a couple rounds. You can also do Sculptra in this area.
There you go.
Sculptra. So Sculptra is
No financial interest.
no financial interest. And, we
Wish
typically
we had some financial. Can we get some financial
would
interest?
love some interest.
They need to give us some interest. Like that would be awesome. It'd be great to be like, and Sculptra, and we are paid consultants for the,
No, not at all.
we're not.
No.
Not at all.
No one's going to pay us because they don't know what's going to come out of our mouths.
That has been a comment from most of our potential sponsors
Yeah.
is like, so we'd like to sponsor your podcast. Can we read the script before you guys go on? We're like, there's not really a script.
Kinda an
And like,
off-book
yeah, well, we'd
thing.
like to really be able to say what you're going to say so that we can make sure that we control. And we're like,
No.
yeah, that's not how this
Yeah.
really works. We kind of just sit here and it happens the way it happens.
Right. But Sculptra is a injectable product. We use it in the face. You can use it in the butt. You can kind of use it wherever you need soft tissue. And you don't get immediate volume, but after you inject it, it stimulates the body to create its own collagen. And so over a period of several months, you can create volume in any given area. And it's a nice option because you don't have to have a surgery or a procedure or anything like that. And I think also using Renuva, which is an off-the-shelf fat matrix, similar to Sculptra. Sculptra creates collagen. Renuva creates fat. Same way. It stimulates your body to create fat. But I would say I would only use Renuva if I had already done fat grafting, if I had created a healthy bed of fat already in that area, and maybe I just needed a little bit more fat and we didn't want to do a whole nother procedure again.
So Renuva is a product from MTF, for which I am a consultant for
There you
MTF.
go.
So I don't really use MTF. The reason I'm a consultant to MTF is, I don't really use Renuva. The reason I'm a consultant to MTF is because I use a lot of their Profiles rib cartilage. But one of their products is Renuva, and I love the product. I just don't do enough BBLs to need it. I pretty much do fat grafting and I have plenty of fat.
It's not really for BBLs.
It's
This
not.
is for women that need small focal areas of fat, and either they don't have a lot of their own fat,
Which there are plenty of women
plenty
around
of
LA
women
that
like
way.
that, or they just don't want to have a harvest or donor site. So I'll use it for like little contour deformities in the breast. I have a couple ladies, I put it in their face, or I'll alternate with Renuva and fat grafting, and in particularly intractable cases. So it's just another option for small areas that need a little bit of fat.
Yeah, and it's the problem for me with Renuva, and not to say that this is a total hurdle, but it's expensive.
Oh,
it
it
is.
is.
It's really pricey,
It's
and it's
really-
not that's not a giant hurdle for a lot of my patients. But like, if I needed some, I'd be like, "Excuse me,
That's a lot
how
of
much that
money.
cost?"
So think about these
What?
numbers, right? So you say your skinny BBL is 200 to 300 cc's. A larger BBL can be anywhere from 800 to 1200 cc's. Renuva comes in 1, 3, and 5 cc syringes. A 1 cc syringe costs anywhere from $1,200 to $1,500. So like, do the math on that. You want 3, 4 cc's of fat in your face. It's great.
It's cost prohibitive.
But it's $5,000-$6,000.
For the average Joe, it is,
Right. It's expensive.
or Josephine, it is a cost prohibitive product. It's too expensive.
Yeah.
I mean, I think it's a good product, and I just there's got to be a way to make it less expensive. It's donor fat. And by the way, if you put a sign outside of the office and said, "Who'd like to donate some fat?"
Line down the
line
block.
down the block of people that want to donate, right? Like, I'll donate. It's great. Take all you want. Like, here, take
I
this.
got it.
Yeah, I mean, of course, but does it have to be $1,100 a cc?
I mean, someone's got to make money in this country, right?
C?
So those are the options for
It's a lot.
for recreating volume. Now, the other thing that I think is really important to talk about in this area is the skin around this area. So over time, with age, with gravity, you will find that the skin of the upper body, of the torso, of the abdomen, of the hips gets loose. And that's just what happens over time, or especially with babies, especially with weight loss.
Well, with age, too.
And with age. And so this area, these hip dips, are very fixed areas. The skin is literally adherent to the underlying fascia, and it is not something that's going to move or change over time. The skin above and below this area is very mobile, and it will respond to the forces of gravity and time. So sometimes the skin of the hip area starts to get loose and it starts to hang, and it accentuates this area that's more concave and more fixed. In cases like that, depending on each individual person's anatomy and their skin and what they have going on, sometimes a tummy tuck can actually be really helpful because it pulls up the extra skin and removes it. A tummy tuck with fat grafting in this area, I love that procedure. I did that actually quite recently, and she looks great. She has a beautiful contour, small waist, her hips are defined, she has a nice hourglass figure, and the hip dips are filled in, and that extra skin that was hanging over the hip bones is now gone.
Well, and that's because you are a surgical artist, and that's what it takes to make this look nice. The whole point of filling in the hip dips is for balance. It's for making, that Violin Deformity, which I love. I'm totally down with that. Like, I want graphics of the violin, and I want to show some hip dips, and we're gonna show what that is. But it's all about surgical artistry and making things look really balanced and harmonious, and the hip dips aren't a problem because they're kind of a normal structure.
They're totally
I was asking you about
normal.
what are the structures in the back. Those two little dots, like where the sacroiliac joints are, like some people have these like
Very
two
prominent
little dents in their back above their butt that and some don't.
Yes, and I said when I was in high school, I was very jealous of those girls that had them, and why some girls have them and why they don't.
They're like back dimples.
They're like back dimples. I wanted back dimples, so it's just normal.
Maybe we could make those.
How do you hide $1 from a plastic surgeon?
I think I see a new operation coming up, a new trend, back dimple creation.
Dimples. But
because some people have them, some
people don't.
Some people have hip dips, some don't.
It's literally just your anatomy. Like, that's all it is. It's not that you're too fat. It's not that you're too thin. It's not that anything. That's literally just how you're built.
Yeah, and that's a big take-home message for a lot of patients is like, this is how you were created. And then so modifying it is not, it's not trivial. It's a real planned intervention that you have to have, an end game, a goal. You have to kind of know what you're up against to get there. I mean, I have a lot of patients that really want, those kind of contours, but they're not really built that way.
No. We can do a lot as plastic surgeons for sure. But as much as my patients would love me to be a magic wand surgeon, I'm just not. Patients come with certain constraints. Our practices and our procedures and our skill sets can only take us so far. Like sometimes, I would love to create a beautiful hourglass in every single one of my patients, but sometimes that's just not how their anatomy is made.
It is a very, very strong quote that Terry Dubrow says all the time. It's a scalpel, not a magic wand.
It's true.
And he says it like with an indignance that I'm just like, yeah, what he said. It's true. It is a scalpel. It is not a magic wand. And, you're cutting and you're sewing, you're putting things together and you're moving things around and you're grafting but it's not, it's not the Tinkerbell.
It's not the Tinkerbell.
It's not.
No.
You don't ding. Even though the patients would love it to be that.
I know, and I get it. But I think that's I think we wrapped it up with the hip dips. This is something that definitely I'm glad was brought to our attention because I don't think we do have a specific podcast for that. So again, if anyone out there has specific things we have not touched on that you would love to hear or have us refresh, let us know, because I think this was a really helpful topic because we talk about it literally all the time, but we just hadn't thought to put it, in so many formal words. So
yeah, and it just is a quick. Maybe it's the next round of this kind of a podcast. It's also like the peanut head from the deficits of the temporal, because fat grafting the temporal deficits is not simple either. So
stay tuned.
Stay tuned. That'll be our next one.
Well, in that case, this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.